I'm Dr. Asim Javed and I'm an interventional cardiologist working at Rawalpindi Institute of Cardiology in Pakistan. This is a series of talks to facilitate learning of image interpretation in coronary intravascular ultrasound. So the common artifacts are ring down and near view artifacts, which are actually seen only with solid state catheters, which are the example is the volcano IVUS eagle eye catheter. Then three artifacts that are only seen with rotational catheters, that is Boston Scientific's iLab, are non-uniform rotational distortion or NERD, air bubbles and stitch artifacts. Remaining artifacts are common to both, which are contrast artifacts, reverberations, guiding catheter artifacts, guide wire artifacts and side lobes. Now, ring down artifact. So, what exactly that means? So, ring down artifact. One thing we know that this is only seen with IVUS with the solid state catheters. Now, ring down artifact is digital subtraction of guide catheter artifact by the machine on pressing the button. It is done as soon as the IVUS catheter enters the coronary artery, for example, the left main stem. This area becomes unavailable for imaging, seen as bright halo of variable thickness surrounding the catheter. So that's the area which is surrounding the catheter, and this is the area. Now this is the ring, and there's a ring down option on the machine. You have to press that button and this ring will disappear. And if you don't make this disappear, this will hinder with all your recordings, all your measurements as you go down into the coronary. So the best time to remove this ring artifact is the moment the catheter, the IVUS catheter exits the guide catheter tip, comes into the left main stem. Now that's the best place to press the ring down option on the machine and make this artifact disappear, because in the left main stem, that's a bigger size coronary where the IVUS catheter does not touch any of the walls, because if it's touching one of the walls, the artifact may persist there and you may have to press more than once sometimes to remove this ring completely. So before you go down into the coronaries where the size becomes smaller, you need to get rid of this this artifact. So that's ring down artifact. Now here you can see that if it's not done properly in time, then the artifact may persist even down in the coronaries. Here is another example. The ring is still persistent. The halo around it is still persistent. So at times it becomes difficult to differentiate between this ring and the actual plaque around it. Again, you can see here this part of the ring is still persistent, and you need to press the ring down button at least twice maybe to make this disappear. Now, another artifact is the near view artifact. So what exactly is near view? So near view is that the IVUS catheter position may have to be changed before trying ring down again to avoid those bright structures. You see these bright structures here? I'll show you there. Now these bright structures, this is what we are talking of. So what are the causes? That is inadequate ring down and shadows caused by bright structures, for example calcium or stent struts. It only occurs within the inner 1.6 millimeter radius of the catheter, and it appears to mimic part of the image and moves with the catheter and not with the image. So now this is an example of near view artifact. You can see it moves with the catheter, but it does not move with the coronary. So and it's a result of inadequate ring down. Ring down should have been done at that time. Now this is again a near view artifact. Now what is NERD? NERD is non-uniform rotational distortion. Now this is something which is very evident from the name, and this, as I described earlier, happens only with the rotational IVUS catheters like Volcano. Why? Because it has a single transducer which has to rotate 360 degrees to form the image. Now, when it's rotating, if at that time it gets pulled or pushed, before it's completed the 360-degree circle, that image will be distorted, and that's called a non-uniform rotational distortion. You can see here, this is an example of NERD. This is how it appears. You really can't discern much when it gets distorted. What could be the reasons for that? One is a bend in a mechanical IVUS catheter that causes unnecessary friction, excessive tightening of hemostatic valve in Y connector. That's why the click system Y connectors are better, because with the rotatory ones you can tighten the catheter too much where it sort of interferes with the movement and speed of the IVUS pullback. Then severe angulation, for example, from the left main stem to circumflex, or the guide catheter is too small, or there is kinking of the sheath or tortuosity of the vessels. These are the situations in which the IVUS catheter can get a jerk and cause non-uniform rotational distortion. Now, this is not seen with Volcano or solid-state IVUS catheters. This is again an example of NERD. You can see the distortion there. That's all distorted image. You can't do any interpretation on this. Then the next is air bubble artifacts. Now, air bubble artifacts are the areas where you may not see any image because of the air bubble present in the catheter. And this again happens with the Boston's rotatory catheter, because these are the ones in which you have to do flushing and you have to remove these air bubbles. So that is an air bubble sitting here. Then this again, if you lose all the visibility, that can be because of air bubbles. Now once you clear these air bubbles, you flush them out and you take the catheter in again, you can see clear distinction between the lumen and the plaque, whereas here you couldn't discern much. This is another example of air artifacts. Even here you can see the whole image is distorted. You can't really make out anything. You've lost the vision of the vessel architecture completely. This can happen because of the air bubbles, and if you have excessive air going down, it can cause air embolism as well. This is again air bubble. You can see the whole imaging is lost. That's air bubble. And after flushing the catheter, you can see the same patient, same catheter, the visibility is back. Contrast artifact. So when you have contrast go in, you can have bright shadows which are as bright as adventitia or even brighter. So you can easily confuse them with calcification. But these shadows are not calcium because they do not have any dropout shadow behind them. Now this is a calcium shadow because you can see the dropout area behind that. But these calcium spots do not have dropout areas behind them, and then they can disappear with the next injection because the contrast gets cleared away. Now, guide catheter reverberations are actually artifacts that are produced because of the guide catheter. So here you can see that's the guide catheter, and once the IVUS catheter comes close to this guide catheter or enters completely into the guide catheter, then the visibility outside the guide catheter of the vessel architecture is actually lost. Therefore, it's very important that in assessing the aorto-ostial lesions, we make sure that the guide catheter is completely pulled out of the coronary ostium before the IVUS is used for study. So at times, not only we study the ostium while being pulled back with the IVUS catheter, but also while going into the coronary ostium. So if it's the left main ostium, I will record it while the catheter is going in, and I will record it while the catheter is coming out, because for the ostium you need the guide catheter to be disengaged and good axial orientation of the guide with the coronary ostium, and then this in and out technique to assess the ostium properly. So this is an image just to show an IVUS catheter pullback. This is the distal side, and from distal we are going towards the proximal side. So that's the stent shadow that you can see. Inside the stent is the ISR or hyperplasia, and that's the IVUS catheter. You're pulling it out backwards proximally, and you can see some white line appearing here, and then now it's a complete white line or complete white circle that you can see, very fine. But then as you come closer to the guide catheter, now it's becoming thicker white shadow, and then once you're completely inside the guide catheter, you will probably lose complete visibility of this vessel wall. Again, guide catheter can have two sorts of appearances depending on the make of the guide catheter and the machine settings. It can be a single thick white circle, or it can be double lining circle. So these are double lining for this type of catheters. Let me just slow this down and let me play it for you. So here you can see that's a stent, and you can see the IVUS catheter in the middle, and then as we move further backwards while pulling out, you can see the guide catheter coming in, and it's a double density circle that you can see, and there you are further closer to the guide catheter. And then as you go further backwards, now you're going completely into the guide catheter, and you can see that you've lost complete visibility of the vessel architecture because the guide is now sucked into the ostium, and you've pulled your IVUS catheter into the guide catheter. So you might still be in the ostium of the coronary, but you can't study the ostium because you're actually blocking the visibility because of the guide catheter walls. Now, what is a stitch artifact? Stitch artifact is seen only with the rotational IVUS catheters. That is the Boston catheter, and not with volcano catheter. What happens is with the single transducer, it revolves 360 degrees and then forms the image. And when it is moving 360 degrees, it has to stitch the visibility from all angles, so it has to stitch them to form one image. And at times you can see a line like this, straight line. Now if you zoom it on, you can see here that's a complete straight line that you see. If you see such a straight line in the image here, line like this, that's a stitch artifact. That's where the machine has stitched the image actually. You can have stent reverberations. What that means is behind the stents you can see these spokes like white images going backwards. These are stent reverberations. There's nothing much about it, nothing significant really. You can have guide wire artifacts, and depending on the machine setting, you can have the artifact with white shadow going like this, or you can have black dropout shadow like this. With two wires, there are two black shadows going like this. So it can be white or it can be black, but these are guide wire artifacts, and you can use this artifact to your advantage, especially in CTO angioplasties where you have an ambiguous proximal cap and you locate the ambiguous proximal cap with an IVUS catheter. Then in order to puncture that cap, with the help of this artifact, you point your wire towards that ambiguous proximal cap where the branch is, and then you push the wire in. We will see this in the CTO talk, but you can use these artifacts to your advantage to see the direction of the wire.